Hey, good evening and welcome to the webinar on fitness and performance, acupressure and training. For those of you who are here the first time, I'd ask you to stay muted and turn the video off, and we'll use the chat function to communicate. So at the end, we will have time for questions. But also during the presentation, if you have any questions, you can put them into the chat function. I will keep an eye on it. And if it fits in, I will answer them straight away. Also, I hope you can hear me well. If there are any issues, please also use the chat function. And there will be a replay available of this together with downloads a couple of days after the event, which you will receive a link to via email. So fitness and performance. We'll have I have to get this one window away here. Okay. So we'll have an overview on fitness, the cardiovascular system, and then the heart in traditional Chinese medicine. So how the heart is seen from a TCM perspective. Also the pericardium, which is closely related to the heart. And then we will finish with a few additional acupoints and question and answers. So, and before we start having a look at training in general, I would like to get a bit of information from you, because I'd like to know in what equestrian disciplines you are involved. I'm not sure. I have a poll here. It's anonymous, and you can use several options, and I've probably forgotten something, but just to get an idea what you are doing, if you are actively writing or. Okay. So there are still a few, but you of course don't all have to reply. I still wait a moment, but dressage is leading. Okay, retraining race horses for eventing. That's nice. I love that too. And otherwise we'll have, but I end it here, and then you basically can see it. So most is in dressage, and then we have show jumping, eventing, trail riding, and other. But it's interesting because I'm doing the same in, you see it here now. Now you should see it in German, and the percentages are actually quite similar. So that's interesting. So it's internationally, it seems. So training in general, of course, for fitness and performance, acupressure, what we are doing here today, can only be a very little part of it, so that we can support the body a bit to achieve fitness and performance. But of course, the main thing, and somebody is drawing lines into my presentation, so if you can turn that off, it would be great. So the acupressure, of course, it's only support, and the main thing, we unfortunately cannot magically push a few buttons and have a fit horse. So the physical training is the major part in it. Thanks. And through exercise, it makes the task of the horse easier. For example, allows the horse to exercise for longer, to run faster, jump higher or further, and accelerate faster. Because with training, the locomotory muscles and the heart, which are also made of muscles, have the capacity to change and to adapt and to build up strength to the demands of the exercise. And other type of training would be more focused on improving skills and modifying behavior. But physical training results are achieved with consistency and change of intensity. So consistency is one of the major factors in it. And of course, that we build up the horse slowly and in accordance with what they are able to do. So what is required? There's physical health, of course, the basic requirement for training, proper nutrition, and correct training methods, because they are vital to muscle development and the development of the right muscles. And the cardiovascular fitness is necessary to basically provide oxygen and nutrients to the muscles. So those two work pretty much together. And conditioning in that sense should be a component of every performance horse, no matter what discipline. So, and a quick look at the vital signs of the horse. That's just the average ones and in at rest, particularly heart rate per minute, 28 to 40 in the average adult horse. But particularly heart rate monitoring is suitable to assess fitness when we take the heart rate during training and then watch for the progress. It's a good tool to basically get an indication about where we are going. Then respiration per minute is 8 to 16 and the temperature is 37.5 to 38.2. It's always degrees Celsius. It's always actually good to know the average values here of your own horses, so that you can basically identify any irregularities quickly. So, and then we have a closer look at the cardiovascular system, a very basic one. So, but just to have an idea from our Western view before we move to the traditional Chinese medicine view on it. So the cardiovascular system is the circulatory or cardiovascular system is responsible for the distribution of substances that an organism, that the body requires for its life. For example, oxygen, nutrients, hormones, etc. And the circulatory system, the term refers to the function or the physiology of the system. That means the circulation of the blood around the body and throughout the body. Whereas the term cardiovascular system relates to the structure or the anatomy of the system. That means the cardio in relation to the heart and vascular in relation to the blood vessels. And basically, the cardiovascular system is, in simple words, a pump, a pipeline system, and a medium. Like the pump is the heart, the blood vessels, the pipeline system, and the medium, the blood that's basically runs through it. So, and no, there we are. So, and that's what the heart looks like in the horse's body. And it's the center of the circulatory system and pumps the blood throughout the body. And it is a hollow organ that is made up of a special type of muscular tissue. And in an adult horse, the average weight is between 4 and 6 kilos. And from here, we'll have a look what the traditional Chinese medicine, where it basically puts the heart to. And we have here the 5 elements, which are our 5 phases of transformation, which are one of the basic teachings of traditional Chinese medicine, and have a function in diagnosis, but also when you work with acupressure and point selection, and also identifying certain patterns and certain patterns of imbalances. So there we have metal, water, wood, fire, and earth. And the heart belongs to the fire element. So to each element, we have, there are 12 major meridians and organs in traditional Chinese medicine, and each element is associated with 2 major meridians and organs, or here in the case of a fire, 4. So we have the heart and the small intestine, and also the pericardium and the triple heater. And we will go deeper to look deeper into the heart and also the pericardium. And just because the triple heater may be a bit more confusing from our Western point of view, it is an organ that has no physical form. It's only an energetic component, and it's a part of traditional Chinese medicine. Otherwise, also, when we speak, for example, now of the heart, it does include the heart that we had here, like the anatomical organ with its functions. But in Chinese medicine, the term heart is, there's associated much more to it. So we have, for example, like flavors associated with those organs. That would be bitter here. Emotions, in this case, where it would be joy. So if we have, for example, a horse that seems kind of be depressed or lacks energy, attitude, then that indicates also that there may be an imbalance in that area on the level of the heart meridian, for example. And also we see here the vascular system, which is quite, in this case, it's very closely related to our Western point of view, where it's not so obvious, for example, maybe with other things. We had spoken about it in previous sessions, that the skin and the body hair relates for the long and the large intestine. So that's basically just a quick overview on the elements and the associations. And as said, the heart belongs to the fire element. And the meridian of the heart runs, it starts, you see the red line here, it starts in the chest. You can't really see the start point because it's in the chest close to the heart. And then it runs medially on the leg, it crosses over, and then it runs down here caudolaterally and ends caudolaterally on the coronary band with the acupoint heart 9. So there are 9 acupoints on the heart meridian. And just for clarification, there's on this foreleg is runs the heart meridian, and on the other one as well. So that means it's just for visibility. This one would start on the inside here, run on the inside, turn over and run down. And equally, this one starts here, runs down medially, turns over, and continues to run down laterally on the foreleg. There are 12 major meridians, and they run bilaterally on the horse. So they would be on both sides. So, and the heart, which is called Xin in Chinese, we had, in my acupuncture training, we would use to use the Chinese terms just for the simple reason, as I said, that our language doesn't, with the heart and all the other organs and other terms which we will come across, does not fully reflect what the Chinese mean by it, because there's usually much more associated with it. So the heart is the highest official and responsible for the clarity of Shen. In the Chinese point of view, the organs are they're all working together, and there's kind of a hierarchy as well, where everyone has their own functions and tasks. And the heart would be a bit on top of it, like an emperor. And the clarity of Shen. Shen is the spirit, in Chinese medicine, but we will come across it a few times during the presentation. And it's associated with the heart, as we said. It's not the soul, because there are other soul aspects in Chinese medicine as well. And Shen here with a star, that's the reason it's commonly used like that in the literature, because the kidney also means Shen. So if the Shen is used without a star, we are usually speaking of the kidney, and Shen with a star, it's the spirit that resides in the heart. And that means in relation to that the psychological activities and consciousness are housed there. And in relation to fitness, it's also quite important component, because the attitude of the horse and its will to work, it's all aspects that influence training, fitness, and the outcome of training. So if there's an imbalance there, it may not be as, our work may not be as efficient. And then also the heart governs blood, which is quite, can be quite comparable in the way we see it, or it is worked in our Western point of view, and it's responsible for blood circulation. So a healthy heart supplies the entire body with sufficient blood. Also, the heart moves the blood throughout the body and controls the blood vessels. And also the heart controls sweat. So that means if there's any irregularities in that area, that means extensive sweating, for example, that may indicate that there is an imbalance on the level of the heart, the meridian or the organ. So, and there I have the first acupoint for you that you actually can use to support the heart function of your horse. And some of you know the association points already. The one we look at now is bladder 15, which is the association point for the heart. There are 12 points. So we are at 12 again, 12 major meridians and organs. So these 12 points are all related to one meridian organ. And here it's bladder 15. Bladder 15 is 3 Sun lateral to the dorsal midline in the 10th intercostal space between the muscles longissimus dorsi and iliocostalis. And the best way to locate it on the horse is that you find the end of the rib cage, and then you basically count forward the intercostal spaces. And when you are at the 10th, you have bladder 15. And 3 Sun is a Chinese measurement. A rough guideline is that it is 6 finger width or a hand width. And but it's also the anatomical descriptions are a guideline, and generally you can feel acupoints as well. They are, so it's with practice, the intention should be to develop a feeling to find and feel where an acupoint actually really is. But this is where you start with, so to go and find them. And also for the point locations, just to add, because with the replay and the downloads, you will get videos from me for point location. I forgot to say at the start, for the ones who were here last time, I have not uploaded the videos yet, as you may have noticed, for the point location, and I will add them within the next few days. There were a few challenges here with extreme minus degrees, but I haven't forgotten it. So I'll send you an email for that as well. And bladder 15, as said, supports the heart. It calms the mind. So that's where you can use bladder 15 as well on the horse. It regulates the circulation of blood and qi. And for Western indications, it's pain in the heart area, also cough. That's basically also because of the location of it. We have here bladder 13, that is for the lung. That's of course for coughing as well. That's the one for the pericardium, which we will look at in a minute. And so because they are just really above the lung, it's a good point to work with all the three of them if there is an imbalance, and anxiety as well. And because blood is such a big role here, and it's also very important in traditional Chinese medicine and general, we will have a bit of a look at blood as such. And again, I've added the Chinese term, which is xue, because blood in Chinese, it's the red liquid that we runs in our horses and our own bodies. But it, again, involves a few more aspects. And in traditional Chinese medicine, blood is a material aspect of qi, kind of a yin version of qi. Qi is translated as life energy. And without qi, no life is possible from a TCM perspective. And we had looked a bit in depth in the first session. And also that yin and yang is a major part and a very basic teaching of traditional Chinese medicine. So that everything basically involves yin and yang. And yin and yang are interdependent and they can't be without each other, but they are always changing as well. And when we look at blood and qi, then blood would be more yin because it's more solid in structure than qi, whereas qi is quite immaterial and you can't really touch it. So that would be more yang in nature. And that already tells us that they are very closely connected. And qi is the ruler of blood. And yin qi, which is the nutrient qi, there are different kinds of qis that run throughout the bodies. That means qi enters the body through food or through the breath, through the air that we breathe in, or the horse. And then it goes through certain processes inside the body where the organs are all involved, and where the qi is transformed and transported and processed and develops into different kinds of qis. And one of that is yin qi, or the nutrient qi, which then generates fluids, distributes them in the blood vessels, and transforms them into blood in order to nourish the extremities, as well as the Zang and the Fu organs. Here again, we have the yin and yang aspects. So Zang organs are yin organs, and Fu organs are yang organs. And the nutrient qi is the qi that forms blood and allows it to flow in the blood vessels in order to nourish the whole body. And both qi and blood flow in the blood vessels. So there is, the heart has the major involvement to basically circulate blood through the blood vessels, whereas the lung is the one who is responsible to circulate the qi through the blood vessels in Chinese medicine. So, and then we have a few more organs involved. Again, the heart governs the blood, the liver stores the blood. So the blood goes into the liver to be restored in a TCM point of view. And the spleen keeps the blood in the vessels. So that is then, if we identify certain imbalances, it's important for us to know the functions, so that we know on what organs or meridians may be involved. And the blood also forms the material basis for Shen. We've spoken about Shen, the spirit, which is responsible for consciousness, because Shen animates the body. And Shen, again, is the least material form of Qi. And Shen resides in the heart and is revealed in the eyes and in the emotions. So basically, you can see whether Shen is in balance by looking into the animal's eyes. So, and the pericardium, which is Xingbao in traditional Chinese medicine, and we had looked at it, again, it belongs to the fire element. And the meridian flows in a similar way to the heart meridian, but not exactly. Again, it starts in the chest area. It runs medially down here and then caudal on the leg. And it ends with pericardium 9, the last point on it, which is basically just between above the heel bulbs. And the pericardium is the ambassador of the monad, which is the heart and responsible for joy. So the pericardium is very closely related to the heart and its functions, and it is responsible to protect the heart. And it supports the heart in its functions like governing blood and also housing the Qi. And if we work with acupoints on the pericardium meridian, we can stimulate blood and tonifer or stimulate Qi. And as said, it's basically also responsible to bring joy. And which is also then the importance for emotions and emotional balance and harmony. Especially also it has a function in being able to have harmonious relationships. The Xingbao, the pericardium, is also referred to as the emotional heart. So, and again, we have an association point, and that's bladder 14, the one for the pericardium. And that's the bladder 15 and the bladder 14 you can use to support the heart function in general. Again, it's trisune lateral to the dorsal midline, and this one is in the 9th intercostal space. So again, you find the end of the rib cage, the last rib, and you count the intercostal spaces forward. It supports the heart, it relaxes the chest, and it calms Qi. And Western indications to use it are heart pain, anxiety, restlessness, cough again, and any lung problems. So, and then we have a few more acupoints that you can use to support generally fitness and when you have a horse in training. And before we start with them, I just quickly, the ones who are here every week know them. We have a few contraindications. So please do not apply acupressure on in-foal mares. That's for the reason that certain acupoints can cause an abortion. And directly before or after feeding heart feed, sudden behavior changes, we really want to be sure that that there are no underlying physical issues, no pain that causes the behavior change. And in emergencies, please call the vet. So, and also what we do here, we pick certain acupoints that are generally efficient for certain conditions or very often. But it's not really a proper TCM assessment or diagnosis. which may come to conclusion that there is a more efficient point for your particular horse or in your particular situation. So just to be clear, so you can't do anything wrong with working with the points, with these points presented here, but they may just not be as effective. So I have 4 points here for you now, which is by Y, gallbladder 34, and I will correct it in the download because I've unfortunately still the German version here. It's stomach 36 and liver 3. So stomach 36 enhances the flow of blood to the legs, and therefore it helps to build healthy muscles. And in general, it actually supports the blood flow to the muscles, not only to the legs. And it is also responsible for the health of the digestive tract, which of course can be, is also beneficial during training. Most of us may be aware that there are so many horses with ulcers, for example. Gallbladder 34 is very much to support tendons and ligaments. Liver 3 influences the harmonious flow both of blood and qi throughout the body and nourishes other internal organs. And by Y is a classic equine acupoint, which helps with emotions and issues, emotional issues, and brings blood and qi to the back and the hindquarters, which is of course important for the functioning in any equestrian discipline. A classic equine acupoint means this one, it is on the governing vessel, which runs over the dorsal midline, but it's not a point of the governing vessel as such, because we have acupoints that are not on a meridian, and they are on certain points. They were identified by the Chinese before basically the meridians were used on horses. So we work with the points on the meridians as such, but also with classic equine acupoints. So, and this one is stomach 36, which is just in the depression, lateral to the distal aspect of the tibial crest, craniolateral to the tibia, on the tibia. So you basically have to become familiar with the underlying anatomy, and then the best way is to orientate yourself on the patella, the stifle, and find the tibia and the tibial crest. And we mentioned that it's beneficial for gastrointestinal problems because it is the master point for the cranial abdomen and the gastrointestinal tract. We have in Chinese medicine certain point classifications, and one of them are the master points. There are 6 of them, and they are beneficial to, they always refer to a certain anatomical region. So here it's the cranial abdomen and the gastrointestinal tract. So that's why you always can use a stomach 36 for any problems in that area. But it's a widely used acupoint, actually. That's why we had it in the last session as well, but because it's so important, I'm just adding it in here again, because it's good to stimulate the immune system and stifle problems as a local point, because it's so close to it, and as also asthma and cough. But it's one of those that is particularly contraindicated during pregnancy. So, and we move to the next one, which is gallbladder 34. It's very close to stomach 36 at the interosseous space between the tibia and fibula. between the long and lateral digital extensors, craniodistal to the head of the fibula. So again, you need to be familiar with the underlying anatomy, and it's a bit of practice and basically palpation to find the point. And that's another point classification in the influential points, and this one is the influential points for tendons and ligaments. So any tendon issues, apart from general supportive fitness, it's a good point to work with and to include in your sessions. But then it's also for a good point to work with for lower back pain, hindquarter issues, muscle cramps or spasms. That's often also when we work on a certain point, we also influence the whole meridian. So by working on that point, you also influence areas where that meridian runs through. And you can always, irrespective of functions, if you have a problem, let's say in that area, you can always work with any acupoints that are basically close to that area, and that applies to the whole body. So that's called working with local points. And then we have liver 3. And liver 3 is on the craniomedial aspect of the cannon bone at the level of the head of the splint bone. And it supports the liver and its function to keep the chi moving. And other indications are pain of the hock and the hip joint and muscle spasms. And then we have YY. And as said, it's on the dorsal midline. It's actually on top here, really in the center, in the lumbosacral space. And it's the point at which all yang meridians merge. So by working with that point, you also influence the yang meridians. And other indications are hindquarter issues, problems of the hip joint, and back problems. So you very much, working with that point, you very much support all this area. But we don't want to forget the respiratory system, because it's of course also very important that the lung functions properly during training. And excuse me, I didn't change the slide, obviously. So I'll change it for the downloads, and you have to put up with my narration for the moment. So that's lung 7. And that's located at the level of the distal border of the chestnut, cranial to the cephalic vein. So that's pretty easy to locate, actually, because you just go and find the chestnut, and then you go to the distal border of it, and at that level you go further forward on the leg where you feel the cephalic vein, and just before the cephalic vein you have lung 7. And it is a master point, and it is the master point for the head and the neck, and it disperses pathogenic wind. We've spoken yesterday in the session. That means we have in Chinese medicine 6 exogenous pathogenic factors, which are wind, cold, dampness, heat, summer heat, and dryness. And so that's just as an additional information for you. If we speak of things like wind and wind cold and whatsoever, that's again certain TCM teachings and theories, which basically help you then to identify patterns and irregularities that you want to address. and it also distributes long qi throughout the body. This is a point to support general, a good point to support general lung function, of course, but also the immune system. Any problems, not only lung problems that you have in the head and the neck, and as well problems of the foreleg, the shoulder, and especially the carpus, because again, it's a local point. It's very close to it. So, and the long meridian runs just over it. So it's beneficial to address any problems there and support them. So and if you like to work with the points that I introduced to you now to support the fitness of your horse, you don't need to work with all of them. I generally recommend that you maybe pick 3 or 4 to work with at one occasion, and then maybe then 2 days later you may pick another few of them. And I would also watch the responses of your horses, because it's always cooperation and communication. So the most horses tell us pretty much what points are efficient or beneficial to them, and what they enjoy by certain signs of release and relaxation. And then I would particularly prefer to maybe mix those then together when you work on it the next time, or maybe then change again. But if you have 3 to 4 points and you work on both sides of the horse, then you have 6 to 8 points to work at one time, and it's actually enough. You can also only use 1 or 2, but I wouldn't go above the 4. And as I said, you work on both sides. So if you use long 7, for example, you use long 7 on the left foreleg as well as on the right foreleg. And basic techniques for point work, there are 2 here. One is the thumb technique. That means you can use the tip of your thumb and place it on the acupoint gently, and as a guideline, start counting maybe to 30 up to a minute, and but basically with practice develop a feeling for how much is needed and how long is it needed, and equally with the pressure. We never work with hard or much pressure. It's very gentle work, and it also depends on the individual horse. So I usually start just by placing my fingers on the horse, and then you may increase the pressure a bit, but it's never really very much pressure, because it's also traditional Chinese medicine has a strong energetic component. So our intention in this work plays a big part, and not so much the strength we put into it. Actually, less is more. And then we have the 2-finger technique, where you work with the tip of your index finger. You put the middle finger on top of the index finger and put it onto the point. And again, as a guideline to start with, slowly count to 30, maybe up to a minute, and you can then feel, and with practice develop a sense of how much is needed. Also, sometimes the horses really tell us pretty clearly if they need more or if they just have enough. So if they have enough, let them have enough, because we don't want to force them to stay and to remain in the work. So, and that's the main information I had to share with you. So if you have any questions, please go ahead.
Hi, my name's Heidi. Hi.
Hi, Heidi.
When you do the points, say
Yes.
the other side, both sides of the withers, would you do them both at once or just one at a time?
You can do them both at once.
Mm-hmm.
Like, I mean, I would say for the start, like I always work with 2 points at the same time. But if you start with it, maybe just to develop your feeling,
Mm-hmm.
maybe start with only 1 point.
Yep.
So that you can focus on it. But generally, yes, you can work with 2 points. You can work with the same points, or if you have on one side 2 points close together, you can work with them at the same time. There's nothing that speaks against it, because
Okay.
in acupuncture, you know, we always, that's why sometimes, that's one of the reasons why I have more possibilities with acupuncture, because you stick different certain needles into the body at the same time. So there's no reason why you shouldn't work with your finger at the same time. But I would just at the start, I would really suggest to stay with one, just to feel into the point and feel what happens there, because you really develop a certain feeling and sensing in your hands and in your fingers,
Mm-hmm.
so that you just don't miss that. But otherwise, no, you can work with both.
Great. Mm-hmm. Thank you.
Yeah. Any more questions?
Hi, could I ask how many points would you generally cover in a treatment session?
In a full treatment session, like the way I work, like the way I personally work is because I have to give you as additional information that I'm in Germany. You don't need to be a vet to work with acupuncture. So I work with needles as well in practice, and I combine in my sessions acupressure and acupuncture. So I would start the session with acupressure, then work with the needles, and then if it is required, but that's basically what the horse tells me, I'd finish with acupressure, or I finish just when I pull the needles out. I wouldn't choose that many points. I also would if we limit it to acupressure, I probably also wouldn't go far beyond 4 or 6 points on one side, because there are different. The thing is with traditional Chinese medicine, acupressure and acupuncture, there are different practitioners, and they work in, the majority works in very different ways, where they put their emphasis on. I've also, the way I've learned to work with very few needles. So sometimes when you see those, I don't know how many needles stuck into a horse's body or a human body, I don't know what they are doing. So because that's not the way I've been trained and I've been taught, because they are all interrelated, the meridians and the organs. So actually your goal is, with all the traditional Chinese medicine theory, to come to diagnosis that that takes these relationships between the meridians and organs into account. So and then in your point selection. So I would say less is more very often, but for a full session, maybe about 6, 5, 4, but not more than 6. No. Does it answer your question?
Yes, thank you.
Okay. So, but for you, because I mean, this is just basically a bit acupressure on a recipe. And it's also, if you just maybe, you may pick the fora on that one chart, or maybe you leave one out there and add another of the other points that I added here. But you can also, of course, into your grooming session, you can add in your grooming sessions 1 or 2 points if your horse responds well to them. So there is basically, you can play around with it a bit. But I personally would say, don't overdo it. And also like that you think you need to cover all the points, because there's interrelationships. I would really pick 4 points and then let them work. Also, I wouldn't do it every day. Leave a few days in between, maybe do it every second day. But it's also, when you do this work, you basically set impulses and you stimulate the body to find back into its own balance. So you are not really adding extra benefit if you do it every day, in my point of view. So I would say do it, but then give it a chance to work and to basically become effective. So, yeah. And I don't know if you don't have any more questions, because I'm really happy to.
Sorry, just a quick
Yeah.
one actually.
Mhm.
The ones on the front legs, would you
Yes.
do all those points, or just the ones that you pointed out?
What other points do you mean on the front legs? Because we only had long 7.
There
Or,
were 9. Yeah, so there were 9 for the sorry, I
oh,
can't
on the
remember.
meridian?
Yes, yeah.
Yeah.
Would you do all those points, or would you
No.
just?
No, I would there basically focus on 1 point. You generally work you generally work only with 1 point on 1 meridian. Sometimes maybe with 2, or for example, when you have the bladder meridian and this close connection to all the other meridians and organs, that may be where you maybe 2 or 3 on the bladder meridian as such.
Yeah.
But generally, because when you have that point, like for example with the long meridian on the front leg,
Yeah.
that has 9 points, when you work on that, you just try to pick the best point on the long meridian for your issue in general in practice. But with working on that point, you actually influence the whole meridian.
Right. Okay.
So because a good example, I just go back to the right, I'd rather go back to the where I had there they are. An example is, we have like but you can use it in acupressure as well. You have the bladder meridian that starts here at the inner canthus of the eye, runs between the ears, then down the neck, and then there are all these points on the bladder meridian. It runs over the whole body, really. It's the longest meridian. Just runs down over the hog and here caudolaterally, and it ends caudolaterally on the coronary band. So and this one has 67 points on it altogether. And when you work with that, if, for example, if you really have back issues all the way over the back in a horse, and it's reactive all the way, bladder 1 is a very effective point to work with. We actually use it quite often in acupuncture, but you can work on that point with acupressure as well, because it's basically with working on that point, you influence that whole area. So that's just enough from the principle, because you basically set the impulse at that one point,
Mhm.
and then it works its way through the system. And your goal is really generally in practice to develop such a understanding of TCM theory that you are, and your way of assessing, that your assessment is spot on, so that you identify the best point for the issue. Because there are just certain I mean, of course, the long meridian, it's related to the lung, so you basically, with any point on it, you influence the lung.
Mhm.
But there may be one point that's more suitable to address the issue that your horse has. But the others are beneficial as well.
Yeah.
Yeah.
Yeah, that's great. Thank you.
So if there are no more questions, again, I will send you the link for the replay, and as I said, I will add a bit of videos so to make it easier for you to have some guidance for the point localization. And yeah, then I see some of you next week, and everyone else, and everyone have a nice evening. Bye bye.
Thank you. Thank you. Bye.
Bye.